Hi, everyone. Welcome to the Root Cause Solutions for You podcast and YouTube channel. I am super excited today to have a very special guest, Dr. Rachaele Carver, who is a biologic dentist. And I'm going to actually let her introduce herself, and then we'll get right to it. Dr. Carver, thank you so much for being here with us today.
Thank you so much for inviting me, Fabiola. It's an honor. So I started my dental career in 2003 when I graduated from UConn and spent the next 6-7 years doing traditional dentistry until I developed eczema all over my hands. And I went the conventional route, and the doctor just wanted me to be on steroids. At the time, I was 31 years old, and finally, at the third prescription, which was like a cancer immune system altering drug, I said, time out. I said, nope, this is not right. I said, I knew instinctively that my body was trying to tell me something. I just needed to figure it out. So I fired all my doctors and just started reading, and trying to understand really what was happening. And through my journey for my own health, it started to make me think about dentistry a little bit differently. I started thinking, wow, there's so much toxicity in dentistry. We use so many heavy metals and so many chemicals. Could I be doing things differently? Most dentists were kind of trained to be like tooth engineers, the old adage is drill them, fill them, and bill them. And that, again, healing myself naturally made me think, gosh, there must be a better, more natural solution. So that led me, I got really interested in nutrition because I think a lot of my problem was digestion, leaky gut at the time was just starting to kind of come out in the news. And so I went and got a health coaching certificate through the Institute for Integrative Nutrition. And more so because I really just wanted the knowledge, not necessarily that I wanted to be a health coach, but that has really served me well in my practice, really helping to navigate my patients through better oral health. I mean, nutrition plays a huge, huge role, obviously, in all of our health, but, the oral cavity, obviously. Then I went on to learn about ozone therapy, and I was going to a colon hydrotherapist, and she mentioned ozone to me. I'd never heard of it other than, it's, up there and smog is ruining everything. And so I took that course. That led me to an 18-month course in New Jersey, where I got my naturopathic medical degree. So that was really fascinating. And since I've gotten certifications through two of the more biologic organizations, the IABDM and IAOMT, so I became certified to remove the amalgam safely. And through that certification process, obviously a lot more education. So, and then, slowly over the years, been adapting, my practice to incorporate all these biological methods. And again, my main goal is always prevention. How can we prevent the cavities? How can we reverse this gum disease? What is the actual cause of it? Because hopefully someday I will never have to pick up a drill again. That's kind of the dream there. So I appreciate you giving me the opportunity to help create that awareness.
Yeah, no, thank you so much. I mean, you bring a very important concept, right? Which is like, how do you view everything, right? And I feel like something that holistic biologic dentistry does is that it views the person as a whole versus just what might be going on with one tooth. And what may be going on with that tooth, how is that a symptom, right, or a ramification of our nutrition. And I think Dr. Weston A. Price, right, who was, I believe, a dentist, was very on the path of nutrition and dentistry, how everything ties up together. So I know that as a practitioner and as a person who goes to the dentist, appreciates someone like you who has that broad knowledge versus just, that one tooth or like you said, that one filling, drill it, and then that's it, right?
It was interesting. I found a quote back in 2000 that the Surgeon General had made this determination that oral health was so important and it could be a sign of something else going on the rest of my life. That's been 23 years now. And few people, let alone dentists, have even heard what is biologic or that there is a connection. I think, it's been accepted that oral bacteria can cause heart disease. That's, that's been in the literature, and that, having good oral hygiene will help diabetes management. But that's kind of where it has stopped in the past.
Yeah.
So, it's really important, and important for people to know too that if you call yourself anybody can call themselves a biologic dentist. So it's more of a philosophy. It's not a specialty, say like a root canal specialist or, a gum specialist. We have just, and there are varying degrees of experience within that biologic community. But again, that the philosophy is important. And what I really love with my patients, a lot of patients who know that they're already well educated, when they come to me. And so it's more of a partnership. I learn just as much from my patients as they learn from me, which is great because they may have been doing something that they know works. So then that I can bring that, to the audiences that I speak to my patients. So that's really exciting. And I really think as healers, as practitioners, it should be a partnership. We're not here to fix you. We have some knowledge and expertise, but it really should be a partnership amongst, the patient and, a collection of different kinds of healers. That's the saying, it takes a village, I think is really true.
Yeah, no, that's awesome. And what are some of the tips perhaps that you would recommend to someone who is looking to potentially make that transition from a conventional method or philosophy to more of a holistic and biologic philosophy and a way of life, right? Because it's
definitely
really establishing those routines and thinking differently about the different toothpaste that we have been using for years and are on commercials, and they're perhaps at a lesser price point, right, than some of the more natural and more biocompatible materials for our body. So how would you advise someone to make some of that transition?
So one is, educating yourself. There's tons of stuff, online, lots of websites. The two organizations I mentioned, IAOMT, .org and IABDM.org, tons of resources on those. So those sites are really good. They also have dentist locators, so you can find somebody that may be near you. And then again, we live in such a toxic world. I mean, this is why we're seeing such an explosion of chronic disease today, starting even in our children, which is kind of scary. And as a fellow cell core practitioner, we really believe that toxins really are the main source of most disease. And one of the things we talk about a lot is that toxicity creates deficiency. So there are a lot of toxins we can't avoid in the world today, right? We have to breathe the air, we, drink in the water, it's in our food, so it's very hard. So knowing that there are some ways that we can mitigate these toxicities is really important. And some of the highest amounts of chemicals are found in our beauty care products, right? Oral healthcare products, such as, our toothpaste, our mouthwashes, even some floss, right, has stuff, in it, and that's made with BPA plastic. So, it's hard to do everything all at once, but making simple changes like switching to a toothpaste, and that it has to be a priority. Yes, you may spend a little bit more, but we got to think long term, right? If we are constantly pouring chemicals in our body, maybe it's cheaper, but then maybe 20, 30 years down the line, our healthcare costs are going so sky high because we've our bucket keeps getting fuller and fuller and fuller. The longer we live, the more toxins we accumulate. So it's those little steps. Mouthwash, that is huge for me. We shouldn't be swishing something that's fluorescent blue or green. Like, that is not natural. I mean, simply hydrogen peroxide, this cheap $3 bottle you get in the drugstore, a little bit of that swished with water with a little bit of baking soda. I mean, we don't need all these super fancy products. We just need really good nutrition. And if you think back to the cavemen, and a lot of Dr. Price's work was, these people, the Aborigines, people, in Africa, all of these, different populations, they didn't have toothbrushes, they didn't have toothpaste, yet they had beautiful, healthy mouths, no cavities, didn't need braces, everything was straight because they were eating a really nutritious diet. So it really, it has to start there.
Yeah, and also like the evolution, right, of as far as like how much space we now have in our mouth, that it's led us to have some of our wisdom teeth removed, right, at a certain age for some people. Thankfully I still have mine, so I haven't gone through that process, and I hope not to not to have to go through that process, just because I really keep that in mind, nutrition, and like you said, the toxicities, how that leads to that deficiency. And yeah, like looking for a toothpaste that doesn't have all those chemicals, right, and doesn't have the fluoride, and um but it is also, like you said, that education piece of it, and stuff like that. So no, that's really awesome. Are there any books you would recommend for readers to listeners to start digging into that might be a good introduction?
No, that is a great question, and that's been on my bucket to-do list. The little kind of ebook there.
Yes.
There are books about different, topics. A lot of them are really dense and meant for like the practitioner. That's a really good question, and that I've never been asked that on a podcast, but I should really, do some research on there. There's just so much, there's some good information. One of the sites I really like is Wellness Mama. She has a lot of good like recipes for, natural toothpaste and really good food. I love her, her cookbooks and stuff. So she's got, when I think, a lot of people who seek out that biology, mostly they're mothers, right? And they want the best for their kids. So I think her site is a really good resource. Going to, the Weston A. Price, that website, is fantastic. That has great nutrition, because the one thing that all of those native tribes had in common is they had 10 times the amount of minerals in their diet and 4 times the amount of the fat soluble vitamins, which is vitamin D, vitamin A, vitamin E, and vitamin K. And our foods today, just especially the minerals, our soils have become so depleted that the foods, I think some of the studies that I've looked at, nutrition has declined by about 50% in most fruits and vegetables, only over the last, 50 years. So it's very quickly declined. Now we're talking about creating all this GMO weird engineered food. I mean, that is so scary to me. I mean, there is just, your body cannot recognize that food. And I mean, it's challenging as a mom raising 2 teenage daughters, seeing the stuff they want to eat and the food that gets snuck in their bag. And I'm just dismayed. But again, I can't avoid everything. So what can I do to mitigate those effects? So I give my children those fat soluble vitamins. They take minerals every single day. I make sure they take binders. Again, they're girls. They want to wear their perfume and wear their mascara. And, of course, we try to get all the organic brands, but every week I'm in the rooms. I'm like, where did this come from? Where did this come from? So giving them some kind of binder that's going to trap all of those chemicals, at least they have a little peace of mind that I'm trying to keep their bucket, as empty as possible. But again, it's challenging. And just trying to give them the education so that one day they'll come back to it.
Yeah, no, that's awesome. And like you said, education is power, right? I believe in that concept, where if you know, then you can do something about it, versus the being in the dark and the unknown of things. Yeah, so you talk about something very important, vitamins and minerals, right? And totally, yes, right on point, as far as how our soil has been so depleted over the years. And just, yeah, it's just not something that we tend to think about every day, right? Or just when you go to the grocery store, you may not be thinking about, oh, where did this come from, right? So shopping at farmers markets, right? Really knowing your going organic, because all that stuff is going to go right into the mouth. And and you talked about toxicities creating deficiencies, and the binders. What are some of your favorite binders?
So yes, I'll come back to that one sec. But one thing that you made me think about when I'm talking about toxicities causing deficiency. So typically we think of dental cavities and gum disease, is a bacterial problem. And that's how we're trained, so let's just kill the bacteria and then everything will be fine. But that's only part of the story, right? Because we all have so-called bad bacteria in our mouth. We have so-called bad, we all have candida, right? And it's normal in a healthy body. It's okay to be there. It's when these things get out of balance, right, that we really have that problem. So how does that happen? when we're taking in all these toxins all the time, then this creates deficiency, right? Because your body is, your liver, your kidneys, everything is working overtime to try to process and get these out of there. So you use up your nutrients faster had you not been being bombarded by these toxins, right? So then the whole environment in the body becomes nutrient deficient. That leads to some, acidity in the body. And so the entire environment, when this happens in the mouth, the environment in the mouth changes. Your saliva may become more acidic. You don't have as much phosphate. You don't have as many minerals. And so those good, healthy bacteria start to die because they don't have any nutrition. And those more acidic, nutrient-poor environments allow the so-called pathogenic or bad bacteria to thrive. So that's really what's happening. It's not that we suddenly one day swallow bad bacteria, but that the environment in our entire body has shifted and it allows these other things to thrive. Same thing with Candida. Conditions create a more acidic, less oxygenated environment. So now Candida overgrows because we don't have enough, oxygen and healthy nutrients for the thing. So that's when we need to think about it. So if we just go about killing bad bacteria, but we never then create that healthy environment, we're always going to be fighting the battle, right? We're never going to come to peacetime, right? We're going to be at war all the time. And then the more killing we do, the more imbalance we're creating in our environment. So we need the vitamins and minerals, but we do, those bad things are creating toxins, which then, that vicious cycle of creating more and more deficiency. So we do want to bind up those toxins, that we're having. So my favorite by far are the Cellcore products. This is a company that, after 10 years of struggling with my eczema and trying this and that, it would get a little bit better, but then it would always come back until I found Cellcore. 2 months on their parasite products and gone. I mean, I was like, wow, I spent so much time and energy and money. And I was like, you cannot believe that just these little capsules were able to, but who would have thought? I never would have thought it was parasites, right? But again, I was always trying to treat my symptoms instead of understanding what was causing all those deficiencies. So once I removed the parasites that were causing all those problems, my body was able to turn back on. So that was exciting for me. So then I started really diving into this company. I called up the owners. I'm like, what is this? Who are you people? Like, I got to know you people. And I think, one of the great things about Cellcore, not only do their products really work, but I think part of the reason is like the intention behind that products. They are using energy medicine all the time to make sure their products really work. So they have binders, and they have 4 different ones right now based on what you're trying to bind up. But the special thing about these binders versus, say, a charcoal or a zeolite or chlorella, they have different size chains of carbon that allows them to go beyond the gut to get those toxins that are hiding in our organs and our bones and what have you. They also bind much more tightly than, say, a charcoal, more like a covalent bond, which is, we kind of discuss that as like a strong link of the arm versus just, kind of like this, where charcoal can easily, let things go. And the other special thing about these binders is that because they're made with the fulvic and humic acids, which I explain to patients, kind of like compost, just loaded with natural amino acids, minerals, all the good stuff. They are supplying you with nutrition at the same time as binding the bad, which you got to be careful with. A lot of binders, they will take good minerals with them, so you can get depleted easily. So the fact that they're binding, but also presenting you with the good nutrients at the same time is super beneficial. And special also, a lot of binders you have to take away from food, take away from supplements, take away from your medications. It gets so confusing and hard. And although they do recommend you take them away from prescription medications, it may not be 100% necessary. You can still take it with food. So, I'm giving my kids, so for gum disease, I really like everyone who comes in and has a deep cleaning, we're giving everybody the biotoxin binder. And although it does not taste delicious, I have them open and swallow the capsule because I want to make sure that the binding starts here. If we let them swallow the capsule, it may not open till small intestine. So we're missing a big portion, between the stomach, esophagus, and mouth, getting those toxins out of there. So Very important. So once we can, again, what's special, the binders, I'm binding up the toxins, but I'm also supplying those missing nutrients,
Right.
and that's going to help. And then in combination, I use oral probiotics. I use oxygen drops, proteolytic enzymes. I think enzyme therapy is often, goes unnoticed. And a lot of these bacterial species, fungus, you name it, they get in these thick biofilms. So you can take antibiotics, antifungals, and they may not be able to penetrate those really thick biofilms. So with enzymes, you're able to break through those biofilms. So now all those microorganisms can be recognized and destroyed naturally by the immune system, right? Yeah. So enzymes are really good therapy. I've used it a lot in my patients with arthritis. You can see the stuff in the mouth, and it's like a natural anti-inflammatory instead of always taking the ibuprofen and the aspirin and the Aleve, which have so many side effects. And our liver's already overloaded. We don't want to have to add more to the burden. So and as we get older, our enzymes, our stomach acid all starts to decline. So giving that body a little extra hand really is helpful to get these things going.
Yeah, no, that totally makes sense, because from looking at the whole person, right, versus just what might be going on in the mouth. You mentioned how it may impact other organs, right? Like our liver already being so taxed because we want to get out of pain. We're taking all this pain medication, and just how something as simple as a good quality enzyme can definitely help with that reduction of inflammation. And it just makes me think about the different meridians that are, connected to the different teeth. And can you speak a little bit of that?
Absolutely. That was one of the most fascinating things I ever learned. So some of you may be familiar with the meridian system in Chinese medicine. We have 13 main meridians that connect the top of our head to our toes. And so if you imagine, if it starts in the top of the head, we're going to pass through, the whole oral cavity. So every tooth is related to a different meridian. So for example, wisdom teeth are related to the small intestine and the heart. So, if you have a cavitation, which is when a tooth is extracted and it doesn't heal properly, that little kind of blank bone space can actually harbor all sorts of microorganisms and so it's a little tricky. So if you have, let's say you have a root canal in one tooth, Dr. Jerry Tennant, he's a doctor from Texas, and he did a lot of research on energy. And he says, for every root canal tooth, that will shut down that energy circuit by 60%. Wow. So what does that mean? Does that mean that if you have a root canal, you're going to cause cancer on that meridian? Not necessarily. How I explain it is, let's say you have 100 soldiers in your immune system army. If 60 of them are up here trying to deal with this chronic inflammation, then you only have 40 soldiers left to deal with anything that comes up along that whole meridian. So no, it doesn't cause it, but you have fewer immune cells to be able to conquer, because, we make cancer cells every day of our lives, right? Most of the time, hopefully, we're healthy enough that the immune system recognizes it and gets rid of them. Right. But if we have fewer immune soldiers, those those bad cells may be able to get through and start multiplying. So that's where you have to think. And, root canals are a huge controversy, right, in the biologic world. Some biologists say absolutely every single root canal, you've got to get that out. It's terrible. Yeah. Now, I do believe that every single root canal does, if you were to take it out and analyze it, you would find bacteria, virus, parasites, Lyme, you name it. Yeah. But everybody's immune system is different, right? So if you have a patient who has zero health issues, they have no pain, there's no radiographic evidence of problems on that root canal, do you need to take it out of that person's mouth? Right. Now, I have that conversation. Like, here's what I have learned. But looking at you as a person, it's up to you. Do I think it could harbor? Yes, you have no health issues. So to me, your immune system may be, healthy enough and it's fine, Now, if you're a person who had multiple autoimmune conditions, fibromyalgia, chronic fatigue, I'm more encouraging to get that out of the mouth because, especially if it's on a certain meridian, say, the lower molars are on the large intestine. So let's say you have IBS, Crohn's, one of those kind of digestive disorders, and you've got a root canal, then I might do some more energy testing really in that person and see, is this person, Is this tooth contributing to inflammation? Stuff like that. So really, again, when we talk about biologic and holistic dentistry, in my opinion, that means we have to consider the person as a whole. We're not treating a tooth, right? When I had an associate years ago, I was always trying to teach her, we're not treating a tooth, right? We're treating a person. So where one person might have that treatment, another person with the same situation may have a different treatment, because you have to consider the person, not only their physical health, but what is their mental, their spiritual, all that plays a factor in how somebody wants to deal with their health care. So, I have so many stories where I've had one, for instance, a new patient came in, really didn't have much of a health history other than he'd had follicular lymphoma of his ureter. I said, never heard of that. Okay. And he'd had treatment and he was better. And I looked at his series of x-rays. He had one root canal, and it was right here. And the front teeth are on the uretogenital meridian, right? He'd had the root canal 9 years before he developed the cancer. So again, not to say that root canal caused it, but perhaps with less energy, right, those cells were able to evade the immune system. Yeah. So it's really interesting. And a lot of times, and the tricky thing is most people, if you had a root canal, the tooth is dead. And this is why they will harbor microorganisms. Anything that's dead in the body will harbor viruses. But, there's certain frequencies, all of our cells, all our body parts, we have all these frequencies. So many of us think of our body as just this physical piece of matter, where actually, our cells communicate via light, via energy. There may not be much to the fact that there are even physical receptors on the cells, right? We kind of learned that at the conference we were at last week. So you really have to consider this energy. And I think this is, part of the reason why root canals can go bad. The frequency will attract these pathogens, right? And so, we listened to a lecture last weekend where talked about a woman who had an extraction of wisdom teeth, developed cystic acne 6 months later, and went on for 7-8 years until she had cavitation surgery. Yeah. And what it made me think, even though maybe the extraction wasn't perfect, they left a little piece of root in there, but I've seen cases where, that even an extraction like that, where you leave the person is fine, right? They don't develop any health issues. And if the body's healthy enough, the body will expel those pieces. I've seen it time and time again. A person is detoxing, they get really healthy, and all of a sudden, years later, they'll start expelling little bits of bone. And when I first saw it, I was like, this is so odd. Somebody had deep scaling root planing, and 2 weeks later, pieces of bone came out of an old wisdom tooth extraction. And I said, what? Makes no sense. It wasn't even where we were working. But now that I'm understanding detoxification and how the body really works, it makes sense, right? We cleaned up all the bacteria and the inflammation that was in the mouth. So now the body was healthy enough to expel what it didn't need. So that's what made me think with this cavitation surgery that this person probably had some Lyme or some other chronic infection, low grade enough that it wasn't obvious. And that when you have this extraction and it creates a little kind of hole in the bone, all those organisms can flood right to that site. Yeah. And now in something like a cavitation or a root canal, there's no longer blood supply to that area. So now the immune system can't get there to deal with the infection that's happening. But all of the toxicity that's given off by these organisms is leaching out through the lymph system, getting into the rest of the body. But now the immune system can't get there. And that's why you usually have to intervene with some kind of surgery or ozone or something to get in there. But again, my point is it all comes down to how is the body's overall health, right? And so along those meridians, you need to consider the person's overall health. But again, time and time again, I have so many in the upper first molar that's on the breast meridian. In my practice alone, I've seen 5 cases of breast cancer, and they have an associated infection on an upper first molar. So if I see a root canal and it looks suspicious on an x-ray and they have a breast cancer history in the family, I'm having that conversation and highly recommending that they consider taking it out. But ultimately, it's the patient's choice. But as a healthcare provider, I need to provide them with all the information that I have, educate them, and ultimately support them in their decision.
Yeah, and then you also have like from a terrain perspective, right? Like bringing back toxicities if we've been exposed. Let's say we have a root canal and we're not really chronically ill, but everything is fine, and then we get doused with some sort of chemical exposure or something, and have that tips that terrain, right? And then it just may just be the right combination to
Mm-hmm.
then create that environment for then that problem to then for it to become a problem, right? Because the immune system
Absolutely.
is just busy dealing with the toxicities that we've been exposed to, and then so yeah, I think it makes people think, right? Like, oh
Yeah.
gosh, I may not be chronically ill, but it doesn't mean you're not experiencing.
Correct.
Um,
It's like kind of that bucket, right? It's,
yeah,
how many, when is that bucket going to tip over and have the problem? I mean, because we're getting insulted every day by the toxicity, by the dental work, right? I mean, you've
yeah,
got lots of metal fillings, right? If you have any of
yes,
those, the silver, all silver fillings are
yeah,
50% mercury. Right.
yeah,
And that we were taught in school, yeah, but once it's all amalgamized and into it's fine. You don't release any mercury. But we know that that's not true. There's been lots of studies that every time we're chewing hot liquids, we will release a little bit of mercury vapor. And it
yeah,
is, concerning when you think about how close the brain is
mhm,
to the mouth. But again, everybody's different. But you could
yeah,
have the other big thing we see in the mouth is, say you have a silver filling next to a gold crown,
right,
or even a porcelain fused to metal crown. When you have dissimilar metals in the mouth, you create galvanism, which
yeah,
is basically like a battery in your mouth. So, I've seen many cases before I really understood what was going on. Patients with mouthful of these amalgams and heart issues.
yeah,
So, not just the gum disease portion, but so many different mixes of metals causing all this like atrial fibrillation and weird, things, because again, you have batteries happening in your mouth. So that's a consideration too. And a lot of people don't realize, because the crown will look tooth colored, they don't realize what the metal is underneath that. And some of those metals are, because the cheapest metals have the nickel and the cobalt and some of those metals that are really unhealthy for us.
yeah, yeah. And I just think like, like as a consumer, right, as a patient, like you mentioned, it's ultimately the patient's decision on how to go about treatment.
Mm-hmm.
And the more education one has as a patient, then we can make a better educated decision, but also demanding better care from like our insurance companies, right?
Yeah.
Who are, have such a pulse on determining treatment, whether,
Mm-hmm.
and most people don't want to do something even though they really need to, because the insurance company may not cover it. But
Mm-hmm.
I remember one time someone mentioning or describing insurance as it's a coupon. Just
Yeah.
think of it as you have a coupon and you have so much of it, and then you just have to apply that coupon towards whatever your next purchase is going to be,
Yeah.
and not letting ourselves be our care be dictated by someone else, but leaving it to professionals who are, really with the intention of helping others to
Mm-hmm.
really get better. So also that mentality, right? That
Yeah.
shift.
Yeah,
Um,
that's important, because I mean, the amount of insurance that people are allowed today is what it was in 1960. I mean,
yeah,
that's insane, right? We're 50, 60, 70 years later, and and meanwhile, every year, your deductible, your payments are going up and up and up, but you're not getting any more. And
yeah,
just like everything, the cost of healthcare is outrageous. It
yeah,
is very, very challenging. So, and insurances, they're not doctors. They're only were, interested in their bottom line.
yeah,
And they made a fortune during COVID, because they were still getting their money, but they didn't pay out for,
yeah,
2.5, 3 months, or depending on, I had patients who didn't come back, for a year or so. So,
yeah,
it's unfortunate the way that it is, but, that people have to, have, what are their priorities?
yeah,
Sometimes we think, like, if you don't, one of my office managers, she gave me a nice little quote and said, if we don't take time for our wellness, we're going to have to make time for our sickness.
yeah,
Right. And so it's the same thing, sometimes we have to, it hurts, to pay this kind of money for this kind of stuff, but we're, in the long run, that's what we're trying to do, is to, prevent, so many times you see people, they've spent their whole life working, then they retire, and then they're so sick. I mean, I see it time and time and time again. Their nervous system has been, jacked up all the time, and then finally they're able to relax. And now, everything that they've been building and storing up is coming out everywhere. So, so I think it's important, and especially for our youngest generation. Kids now, they're born, there's some studies showing that kids are born with over 200 chemicals in their body before they take their first breath. So they're already born with that bucket half full, right? Yeah. So that's why we're seeing, there was a huge decline in cavity rate until about the mid, from like the 70s right down to the early 90s. And then like every other chronic disease, right? Cavities, diabetes, autoimmunity, sky high. And this a lot has to do with the food, right? We are eating just nutrient, and even if we're trying to eat healthy, it's just, again, even organic. So here's the conundrum, like organic, a lot of times organic food has fewer nutrient levels because it's being shipped from so far. Yeah. But it doesn't have the chemicals, So that's why the best, like you said, the best food you can get is local. Right. Local, fresh, right? I mean, because then it's going to, if you can get local organic, that is ideal. If you can grow your own food, awesome. Let me know how you do it. Yeah. My husband bought me a really cool thing for Christmas. It's called The Garden. It's like hydroponic gardening. And we're making all sorts of great, lettuce. We are even growing cucumbers and strawberries. Yeah. It's great. But anyway, that's the choice. Do I need more at least for me, I feel like I'd rather not have the chemicals because they can get embedded in your body and very challenging to get out. Whereas I can supplement myself with nutrients. Yes, that's another cost. So that's challenging because people say, well, I can't do organic. It's too expensive.
Yeah. No, totally. And I love that quote. I think I saw it floating on social media as well. Mm-hmm. I was like, oh, this is such a good one. And taking the time now and educating ourselves and others, right? And then speaking that, not just holding it to yourself, but like, hey, share it with someone else. You read a good book that talks about whatever that is health oriented. Just give it to someone else, right? Just pass it along, because the more of us who know about this, then we can make those kind of decisions, and the man better care. Yes. Whereas hopefully at some point there's a shift, right, with insurances and healthcare and all that stuff.
Yeah, that's the only way we've ever made real progress. I mean, I always think about the gluten-free industry. It didn't even really exist 10, 15 years ago, but people started demanding it and wanting it, and now it's, a $1 billion industry. So that's the same thing. We can try to change the insurance company's mind, change policy, but I'm like, it's kind of, wasted time. Those people they're stuck in their ways. That's the way it is. But if people start demanding more of this, the interest in this natural healthcare, these more root cause solutions, then, I mean, just, the people seeking alternative, I hate that word alternative, but more holistic treatments, more natural healing. I mean, that has grown by leaps and bounds because people are demanding. And so that's what we need to do by getting that education out and helping people come up with solutions. So, okay, I have a family. We can't always afford organic. Okay, well then there's a great thing on the internet you can look up, right? The Dirty Dozen. There's 12 every year, right? They come out with the 12 foods that have the most amount of pesticides. Yep. So at the very least, just try to avoid, those products, right? And if you can, more and more, around where we are, there's lots of farmers markets, local people. More and more people, I think, are growing their own meat. I mean, we have, a small little kind of family farm. We're growing our own cows, our own pigs, chickens for our own eggs. And most communities are open. I mean, the town next to us, which is, much more condensed with people, they've got little tiny 1 acre lots with chickens in the backyard, so that's exciting to see that. Yeah. And, but there's some of us who, I don't want to raise, livestock, but looking for, the places. There are companies like Butcher Box, right, that you can get grass-fed meat from, which I was doing before we started doing our own stuff, which is again expensive. But you got to think of like, where do we want our priorities to be? Should I forego my Dunkin' Donuts coffee so that I can afford the grass-fed ground beef? Right. Again, everybody has their own, and there's zero judgment here. Zero judgment. I had Dunkin' Donuts yesterday. Okay. it's how we shift our priorities and what is most important to us. And it changes, I think, as we go through different stages of life, our priorities will shift a little. But when we're armed with all the education, we can make those right choices. I mean, we live in a modern world. It's really hard. And one of the biggest things I try to teach my patients is, yes, we want to eat nutrient-dense foods, but we could be eating the healthiest salad, say, but if we're doing it in front of the TV or while we're trying to answer emails or, while we're stressed out, we're not going to absorb any of that nutrition. So not only what we eat, but how are we eating? Can we get into that? Because if we are in that anxious, revved up, sympathetic nervous system, our body is focused on, keeping our heart rate and trying to keep us alive. It's not focused on digestion. So we really want to consider that and really, the mind body. The more I got into my own healing and got into that energy medicine and the emotional, spiritual space, and like, if you can't, you have to be in the right mindset. And I think one of the reasons I had a hard time with my kids at first and why they really bucked against me trying to feed them healthy stuff is because I was coming at it with fear. If you don't do this, you're going to have a cavity or you're going to get sick or whatever. Instead of from a loving place, guess what I learned? We're going to try, let's all try to do this. So I try to teach my mom, because I see a lot of moms come to me and they're very holistic, and their kids, they're so confused. Why does my kid have so many cavities? Yeah. And I look at them and myself, very similar, like, because as moms, we're so fearful. We're so worried. We are so educated, but instead of using that, and it's challenging, I know, I try it all the time, don't come from that place of fear, because fear is one of the lowest frequencies there is, right? Fear and hate, they're way down the bottom. Love is the complete opposite. Love and hate are not opposites. Love and fear are opposites. So as moms, and I'm working on this every day, when I learn something new, it can't come across as a fear. And of course, us moms, we have our best intentions. We want what's best for our kids, but sometimes, and remember, kids, they're a lot closer to the consciousness than we are, right? They haven't had all that stuff beat out of them yet. So they feel our energy much more strongly than adults do. So when we're coming at them with that fear, even though we don't think we're fearful, or think we're doing it out of love, that energy can easily shift and can create stress in the kids. And as I just said, when the kids are feeling stressful because, their parents are feeling stressful, then that's when they can get those health issues too. So I don't have all the answers to that, because it's something I'm working on all the time. But I think it's a really, when we're talking about nutrition, that we need that love nutrition is really important too, because when we feel calm and in a good environment, that's when everything works right. When we're in that frequency of love, the body works right, the mind works right, everything works better. So yes, we want the physical nutrition. Yes, we want to brush our teeth, but we also have to have that good, healthy mindset too.
Yeah, no, that's awesome. I love it. And that's why, that, again, that holistic point of view, that biologic point of view, like how does one thing affect the other, and not just looking at one thing like nutrition or dentistry or this, it's like literally every organ of the body, it's impacted by how we eat, the times of the day we eat, our routines, our choice of food, our choice of practitioners. And I encourage anyone who, who's not had solutions, right? Because some people might be like, bounce from one practitioner to the other, from one doctor to the other. And it's just about like, what is that root cause, right? And I do feel like, with a lot of clients that I work with, it always almost boils down to what's going on in your mouth, because we've done everything, right?
That reminds me, I had a new patient yesterday, and he's been working with a practitioner doing all this health stuff, because she kept telling him, you have leaky gut, we need to work on this. And so he did months and months and months, and nothing was changing. So he's like, I just stopped going to her. And not that I didn't like her and value her opinion, but it wasn't working. He came and I looked in his mouth. I was like, well, no wonder, just severe periodontal disease. And I said, you have such disease, such inflammation and an infection in your mouth. You're constantly swallowing that. You're never going to heal your leaky gut if you're constantly putting the infections and the toxicity back into the gut. So again, for practitioners who are listening, so important that you've got to make sure you're asking about the mouth, because you're going to spend so much time and energy. And I know as a practitioner, when something's not working, you kind of feel like a failure, and you want to help people. So when it's not working, it's very frustrating and it makes you feel bad. So please look in the mouth, because again, that's something we swallow, I don't know, a couple hundred times a day. And so we're constantly reseeding the toxins back into the body. So we've got to, and the exciting thing to me about being a dentist is the mouth is so accessible, right? I can easily take out infected teeth. I can help clean up the gums, because it's a lot easier than treating, leaky gut, right? Where we can't see exactly what's going on. I can see exactly what's going on. We have great kind of saliva tests that can screen and look for certain things. So that is one of the easiest ways to get better. Somebody to get better is if you make sure, number one, that the mouth is healthy.
Yeah, no, totally. Yeah. I mean, this reminds me of a case that this lady who's always had like a lot of tension on and cramps on her neck. And I mean, she's been a client for a while now, and we've been working on things. Mold, it's been a huge part for her, and Bartonella, one of the Lyme co-infections, has been a huge part for her. But then I was just like, hey, I mean, you got mercury fillings in your mouth, and it's not just mercury, right? It's silver, copper, zinc, and that stuff is not really meant to be in your body. So finally, went to a biologic dentist, a holistic dentist, and he reiterated what I had already mentioned to her, and how the meridians, right, and all this was so close to her neck. So she's been working slowly to get those amalgams safely removed, right, with the correct procedure, and she feels so much better. Like, she feels like her neck there's not as many spasms. She's not spending all this time in physical therapy. Her supplement protocol, it's shorter too, because her body doesn't need all this extra supplementation, because she's tackled the right thing. So I definitely encourage anyone who it's just, it's been working for a while on getting better, or it just doesn't feel good, to really go and look for a holistic dentist, to really look at that, what's going on in the mouth. And really take that on seriously. So
and
I've seen
that person. Absolutely. And I mean, most physicians, most internists, they wouldn't even think about the mouth, because in modern medicine, we've cut off the head from the rest of the body, right? So, and most of the time you don't feel anything in the mouth. Yeah. So you don't think about it. Your doctor certainly isn't thinking it. Most dentists aren't aware of all these connections. So, so that's why, it's important. We're doing this to create that awareness. And like you said, if there's something, and just like that case we heard this weekend, this girl with the cavity, I mean, 8 years, she had this horrible cystic acne, spent so much time and money trying to fix her face when it was, an infection in the mouth,
So it's like, really handling the correct target, right? Like not something else. No, that's so awesome. We've learned so much, and I think you really broaden our, scope as far as like the things that we need to look at as far as nutrition, how to eat, the different foods, and that are going to be important as far as minerals and vitamins that are important for dental health. Also toxicities, how toxicities create that deficiency, and to just look at the whole person as a whole, and looking yourself as a whole as well, right? Like taking on that as well. Is there anything that you want to leave us with? Any other advice besides everything you already shared with us?
I think one of the things we were mentioning, you talked about people going from doctor to doctor to doctor to doctor, or dentist to dentist to dentist, that and just what you said, you need to look within, because if you expect, and I did this for 10 years, I was expecting something or someone to fix me, but it really had to, yes, I needed support, but you have to go within yourself. What is happening internally that may be also inhibiting. We can try to treat the physical stuff, but is there something mentally or emotionally? Are you not getting enough support? Do you not have supportive relationships? That is a really important thing that I found, because now as a biologician, I'm dealing with people who are very sick, very complex issues. And the theme I see again and again and again is these people who are isolated, right? They don't have good support systems. They think somebody else, can heal them. So again, it's important to understand that you can heal yourself. I totally believe, even without supplementations and a crappy diet, like if you can get into those good meditative states and start here, you're going to be, that's what I'm working on, learning how to get into those states where you can let the fuzziness of modern world go and really focus on the inner world and being with peace, being grateful, showing that the more gratitude we show to each other, to our healthcare providers, to ourselves, I think the better the whole world would be and we would all be a lot healthier.
Yeah, no, that's awesome. I love it. And Dr. Carver, I think you also have a podcast, right? Where people are educating people about dentistry. You want to share a little bit about that?
Yes, thank you so much, Fabiola, for mentioning it. So we just started this wonderful podcast. It's called The Root of the Matter. You can find it on Spotify, Apple, Google, I think, wherever you find most of your podcasts. And I've been interviewing a lot of people to really highlight, again, more of what Fabiola and I have been talking about, this connection of oral disease to systemic disease. So it's, there aren't really many podcasts out there, talking about this. So I'm excited to bring in a lot of practitioners and create that awareness. So thank you for that.
Yeah, of course. No, I've been listening to your chapters as they've been coming out, and it's and sharing them with my clients.
Thank you.
And,
great.
I'm like, oh gosh, this is so awesome, because you really put things in a way that we can all understand. Although, sometimes you can get away from certain words, but everything is still very understandable. And if anyone wanted to find you to potentially refer a friend or family member, or themselves become a patient of your practice, where would they find you?
So you can just go to my website. It's www.carverfamilydentistry.com, or you can reach out to me directly at Dr. Dr. Carver at carverfamilydentistry.com.
Awesome. Perfect. Well, thank you so much, Dr. Carver, for not only being here with us today, but everything that you've done throughout the years to bring great education to your patients and others. And I really appreciate your time on today's episode for Root Cause Solutions for you.
Well, thank you. And thank you to everybody who's listening and taking the time to create health for yourself and spread the awareness.
Awesome. All right. Thank you so much.